So Teresa, you just completed a landmark study with the POWERWAND. As a clinician, how do you feel about that device?
At first I was a little bit skeptical that it was going to be hard to use, didn't know if it was going to work, if it was going to stay in the patient long. And after I started using it and seeing the results, the device is a wonderful tool and is a much needed tool out there. It's fast, it's safe, and I've looked at ultrasound guided IVs for a long time. I've placed them, and I've found that you can take up to 3 or 4 attempts to place an ultrasound guided IV and they are lost right away. With this device, using the wire, the accelerated Seldinger technique, and plus it being longer, they tend to stay in for a long time, as the study's shown. The main benefits of this for the patients is what I heard all the time was it didn't hurt. If you prepared them properly, it didn't hurt. There was some pressure, and so it was one stick, it didn't hurt, and they were very, very pleased. They were afraid at first, all the prep, the maximal barrier, and everything like that, but once it was in, they go, oh, is that all it was? I've had, you know, much more pain and much more difficult time than with regular IVs than with this. I mean, they just loved it.
Were there any patients who got a POWERWAND placed who otherwise might not have had vascular access?
That happened multiple times.
What was it? What happened?
One of the main ones was a patient that had been in and out of our hospital many times. I've known this subject for 6 years. The last time that she got a central access was myself. I placed a 3-French pediatric PICC line on her, and then after that she was no longer able to get a central line, because she had steno. She'd been in and out of the hospital since she was 8 years old. We had attempted to place midlines on her, multiple ultrasound guided IVs on her. Her veins were small. They tend to be not straight and stuff, and with the POWERWAND and the wire guiding us in, we were able to find the one vein that she might have had, and the wire guiding us in and securing that vein, that she was able to get a line, and she was able to get that line for 30 days, and that she was not able to get a central line per the doctor or anything, and so she was able to complete her therapy with the POWERWAND.
So if a clinician who is unfamiliar with the POWERWAND asked you, why should I use this? What are the primary reasons you would recommend it?
Well, why not use it? Why not get an IV in a one stick instead of doing multiple sticks? Because it happens more often than not. And me being an ultrasound proficient clinician and placing lines all the time, I know that it takes more than one stick. And with the wire, the accelerated Seldinger technique, you are guaranteed an access for stick. And so why not use it?